Osteoporosis is often called a silent disease because bone loss can progress without noticeable symptoms until a serious fracture occurs. Men over 50 are particularly at risk, yet many overlook the subtle warning signs that indicate declining bone health. In this video, we'll reveal 4 silent signs of osteoporosis every man should recognize, explain why they matter, and discuss steps to protect your bones. Understanding these early indicators allows men to take action, maintain strength, mobility, and independence, and reduce the risk of fractures as they age. Sign 1. Unexplained height loss or stooped posture. One of the earliest and most overlooked signs of osteoporosis in men over 50 is unexplained height loss or a gradual stooped posture. As bone density decreases, the vertebrae in the spine can weaken and compress, leading to subtle changes in height and alignment. Men may notice that clothes fit differently, or that they appear slightly shorter than a few years ago, but dismiss it as a natural part of aging. Recognizing these changes early is crucial for preventing more serious bone problems. A stooped posture, often referred to as kyphosis, may also develop as a result of vertebral compression fractures caused by osteoporosis. This rounded upper back can reduce mobility, affect balance, and increase the risk of falls. Men over 50 who notice a gradual forward lean or a hunched appearance should take it seriously, as it can indicate underlying bone weakness. Height loss can be measured over time to monitor changes. Even a loss of half an inch to an inch can be significant and may warrant further evaluation. Consistent tracking allows men to detect early signs of osteoporosis before fractures occur, making prevention and treatment more effective. Maintaining good posture and spinal alignment can slow progression. Exercises that strengthen the back, shoulders, and core help support the spine and improve balance. Activities such as resistance training, yoga, or Pilates enhance muscular support for weakened vertebrae, reducing the risk of further compression. Adequate nutrition also plays a critical role. Calcium and vitamin D are essential for bone density, while protein supports muscle strength, which in turn stabilizes the spine. Men over 50 should ensure their diet includes dairy, leafy greens, fatty fish, and fortified foods to maintain optimal bone health. Medical evaluation is important when height loss or stooped posture is noticed. Bone density tests, such as a DEXA scan, can assess the strength of the vertebrae and other bones, helping guide preventive or therapeutic measures. Early detection allows men to implement lifestyle changes or treatments that preserve bone integrity and prevent fractures. By paying attention to height changes and posture, men over 50 can identify one of the silent signs of osteoporosis before it leads to more serious complications. Awareness, combined with strength training, proper nutrition, and medical evaluation, provides a proactive approach to maintaining bone health, energy, and independence. Recognizing unexplained height loss or stooped posture is not just about appearance, it is a critical early indicator of bone fragility. Men who monitor these subtle changes and take timely action can significantly reduce the risk of osteoporosis-related injuries and maintain long-term vitality. Sign 2. Recurring back pain or spinal discomfort. Recurring back pain or discomfort in the spine is another silent sign of osteoporosis that men over 50 often overlook. Unlike typical muscle soreness from activity, this type of pain may appear gradually, without a specific injury, and can persist for weeks or months. It often signals weakening vertebrae or microfractures caused by reduced bone density. Early recognition of spinal discomfort is vital for preventing more severe fractures and maintaining mobility, posture, and overall independence. Osteoporosis-related back pain may feel like a dull, constant ache in the mid or lower back. Men may notice increased sensitivity when lifting objects, bending forward, or standing for extended periods. The pain often worsens with activity and eases slightly with rest, but recurring episodes indicate that underlying bone weakness may be present. Ignoring these warning signs can lead to compression fractures, which may exacerbate posture changes, height loss, and reduced functional strength. One of the reasons back pain is often overlooked is that it can resemble common musculoskeletal issues related to aging or minor strain. However, the distinguishing feature is persistence without a clear cause, and sometimes sudden sharp pain with minimal activity, which may indicate microfractures. Men over 50 experiencing this type of discomfort should consider medical evaluation to determine whether osteoporosis is a factor. Preventive measures include maintaining spinal strength through targeted exercises. Core strengthening, back extensions, and gentle resistance training improve muscular support for the vertebrae, reducing stress on weakened bones. Maintaining flexibility through stretches for the spine, hips, and shoulders further supports alignment and reduces pain associated with minor compression. Nutrition is equally important for spinal health. Adequate calcium and vitamin D intake helps preserve bone density, while protein supports muscle mass that stabilizes the spine. Men over 50 should ensure their diet includes foods like dairy, leafy greens, fortified products, and fatty fish to support both bone and muscle integrity. Medical evaluation is key for recurrent spinal discomfort. Bone density scans, imaging, and clinical assessments can identify early osteoporosis and guide interventions to strengthen bones and prevent fractures. Early detection allows men to implement lifestyle adjustments, supplements, or treatments to slow progression and reduce injury risk. Recognizing recurring back pain as a potential sign of osteoporosis allows men to take proactive steps toward bone health. By combining exercise, proper nutrition, and medical monitoring, men over 50 can address spinal weakness, preserve posture, and maintain functional mobility. Persistent back pain may be more than a minor nuisance. It could be a silent warning of osteoporosis. Paying attention to this symptom and acting early is essential for protecting bone strength, preventing fractures, and maintaining independence and vitality as men age. Sign 3. Fractures from minor falls or bumps. One of the most concerning silent signs of osteoporosis in men over 50 is experiencing fractures from minor falls or bumps. Unlike fractures caused by serious trauma, these breaks occur from everyday activities that would not normally result in injury. The underlying cause is weakened bones due to decreased bone density, which compromises strength and resilience. Recognizing these subtle fractures is critical for early intervention and preserving long-term bone health. Men over 50 may notice fractures in the wrist, forearm, ribs, or hip after a fall that seems too minor to cause such an injury. These incidents are often dismissed as clumsiness or bad luck, but they indicate fragile bones that are more susceptible to injury. Even small bumps or simple missteps that result in a fracture should be taken seriously, as they may be an early warning of osteoporosis. Vertebral compression fractures are common in the spine and may occur without obvious trauma. Men might experience sudden back pain, limited mobility, or changes in posture, such as increased rounding of the upper back. These fractures can develop gradually and remain undetected for weeks, making them one of the silent signs that require attention. Preventing fractures begins with maintaining bone density through diet, exercise, and medical monitoring. Adequate intake of calcium, vitamin D, and protein supports bone strength, while resistance training and weight-bearing exercises help stimulate bone growth and maintain structural integrity. Balance and coordination exercises reduce the risk of falls, providing an additional layer of protection for fragile bones. Medical evaluation is essential when fractures occur from minor incidents. Imaging tests, such as X-rays or bone density scans, can determine the extent of bone weakening and guide treatment. Early diagnosis allows men to implement lifestyle changes, supplements, or therapies to strengthen bones, reduce fracture risk, and prevent further complications. Environmental precautions also help prevent fractures. Removing tripping hazards at home, wearing supportive footwear, and using handrails on stairs can reduce the likelihood of falls. Simple adjustments in daily routines can significantly lower the risk of injury for men with weakened bones. Recognizing fractures from minor falls or bumps as a potential sign of osteoporosis allows men to act quickly. Timely interventions, combined with proper nutrition, strength training, and fall prevention strategies, can help maintain bone health, energy, and independence. Even seemingly minor injuries can reveal a hidden problem. Paying attention to unexpected fractures enables men over 50 to take control of their bone health, reduce future risks, and maintain mobility, vitality, and quality of life as they age. Sign 4. Weakening grip and reduced hand strength. A subtle but important silent sign of osteoporosis in men over 50 is weakening grip and reduced hand strength. While often overlooked, decreased grip strength can indicate underlying bone density loss in the hands, wrists, and forearms. Men may notice difficulty opening jars, carrying groceries, or performing simple daily tasks, which can be an early warning that bones are becoming fragile. Recognizing this sign allows for timely intervention to preserve bone health and functional independence. Osteoporosis can weaken the small bones in the hands and wrists, making them more prone to fractures even from minor impacts. Men may experience frequent bumps, discomfort, or mild pain during everyday activities. Reduced grip strength may also accompany loss of muscle mass in the forearm, a condition known as sarcopenia, which often occurs alongside bone density loss. This combination further compromises daily functionality. Simple grip tests, such as squeezing a hand dynamometer or noticing difficulty holding objects, can help men monitor changes over time. Even subtle declines in hand strength may indicate bone fragility and warrant further evaluation. Men who identify these changes early can take proactive steps to maintain bone and muscle health before more serious fractures occur. Strength training exercises for the hands, wrists, and forearms can improve grip strength and support bone health. Activities such as farmer's carries, resistance band wrist exercises, and lightweight lifting stimulate muscles while placing controlled stress on the bones, encouraging density maintenance. Grip exercises also enhance coordination and functional performance in daily tasks. Nutrition is equally important for supporting bone integrity. Adequate intake of calcium, vitamin D, magnesium, and protein strengthens bones and surrounding muscles. Men over 50 should ensure their diet includes dairy, leafy greens, fatty fish, nuts, and seeds to maintain both bone and muscle health. Supplements may be considered if dietary intake is insufficient, following professional guidance. Preventing falls and protecting the hands during daily activities is also critical. Wearing supportive footwear, using handrails, and ensuring a safe home environment reduces the likelihood of fractures. Even minor trauma to fragile bones can result in breaks, so taking precautions enhances safety and confidence. Medical evaluation is essential when grip weakness or hand pain is noticed. Bone density scans and physical assessments can detect early osteoporosis, allowing timely interventions that include lifestyle adjustments, exercise programs, and, if necessary, medications to preserve bone strength. By recognizing weakening grip and reduced hand strength as a silent warning sign, men over 50 can act early to protect their bones, maintain functional independence, and reduce fracture risk. Addressing this subtle indicator through exercise, nutrition, and preventive care ensures that men remain strong, capable, and energetic well into later years. Even small declines in hand strength can signal a hidden problem. Paying attention to this sign allows proactive management of osteoporosis, preserving vitality, mobility, and quality of life for men over 50. How lifestyle and early detection protect bone health. Protecting bone health becomes increasingly important for men over 50, as age-related bone loss can progress silently, leading to fractures and reduced mobility. Lifestyle choices combined with early detection are the most effective ways to maintain strong, resilient bones and prevent osteoporosis-related complications. Understanding and implementing these strategies ensures long-term vitality, independence, and overall wellness. Regular physical activity is a cornerstone of bone health. Weight-bearing exercises such as walking, resistance training, and bodyweight movements stimulate bone formation and strengthen muscles that support the skeleton. Men over 50 benefit from incorporating strength training for the legs, back, and core, which stabilizes the spine and reduces the risk of falls. Even light daily activity helps maintain bone density and functional mobility. Nutrition plays a vital role in preventing bone loss. Adequate intake of calcium, vitamin D, magnesium, and protein supports the structural integrity of bones while maintaining muscle mass. Dairy products, leafy greens, fatty fish, nuts, and seeds provide essential nutrients. Vitamin D from sunlight or supplements aids calcium absorption, ensuring bones receive the support needed to remain strong and resilient. Lifestyle habits also influence bone health. Avoiding smoking, excessive alcohol consumption, and a sedentary lifestyle helps preserve bone density and reduces fracture risk. Maintaining a healthy weight and practicing balance exercises further enhances stability, preventing falls that could lead to breaks and weakened bones. Early detection of osteoporosis is crucial for proactive management. Bone density scans, commonly known as DEXA scans, allow men over 50 to assess bone strength before significant damage occurs. Detecting reduced bone density early enables timely interventions, including lifestyle adjustments, nutritional supplementation, and, when necessary, medications to slow progression and protect bone health. Men should also be attentive to subtle warning signs, such as height loss, stooped posture, recurrent back pain, minor fractures, or reduced grip strength. Recognizing these indicators prompts evaluation and early intervention, which can dramatically reduce the risk of serious injuries. Combining healthy lifestyle practices with regular medical checkups empowers men over 50 to take control of their bone health. Consistency in exercise, proper nutrition, and attention to warning signs work synergistically to strengthen bones, maintain mobility, and improve overall vitality. Balance and fall prevention strategies, such as using handrails, removing tripping hazards, and wearing supportive footwear, complement lifestyle and medical interventions. These simple precautions significantly reduce the risk of fractures, providing confidence and independence in daily activities. By prioritizing lifestyle choices and early detection, men over 50 can protect their bones, preserve strength, and maintain energy and independence. This proactive approach reduces the risk of osteoporosis-related fractures, ensures long-term mobility, and enhances overall quality of life. Bone health is not just about avoiding fractures, it is about staying active, energetic, and resilient. Men who adopt these strategies can prevent silent bone loss, maintain strength, and enjoy independence well into later years. Preventive tips: diet, exercise, and regular screening. Preventing osteoporosis in men over 50 requires a proactive approach that combines proper nutrition, regular exercise, and routine medical screening. Taking early steps to protect bone density ensures long-term strength, reduces fracture risk, and supports mobility and independence as men age. Awareness and consistency are key to maintaining healthy bones. Nutrition is the foundation of bone health. Adequate calcium intake strengthens bones, while vitamin D enhances calcium absorption and supports overall skeletal integrity. Men over 50 should include dairy products, leafy greens, fortified foods, and fatty fish in their diet. Protein is also essential, as it maintains muscle mass that supports bone stability. Magnesium and other trace minerals further contribute to bone density, making a balanced, nutrient-rich diet crucial for long-term wellness. Exercise plays a complementary role in preserving bone strength. Weight-bearing activities such as walking, hiking, or climbing stairs stimulate bone formation, while resistance training strengthens muscles that protect joints and the spine. Men over 50 should incorporate exercises that target the legs, back, core, and upper body to support functional strength and prevent falls. Balance and flexibility exercises, such as yoga or tai chi, further reduce the risk of accidents that could lead to fractures. Regular medical screening is vital for early detection. Bone density scans, or DEXA scans, can identify thinning bones before fractures occur. Men over 50 should discuss the appropriate timing and frequency of scans with their healthcare provider. Early identification of osteoporosis allows for timely interventions, including lifestyle adjustments, supplements, or medications that slow bone loss and reduce fracture risk. Monitoring subtle warning signs is equally important. Height loss, stooped posture, recurring back pain, minor fractures, and weakened grip strength can all indicate declining bone health. Recognizing these signs early prompts medical evaluation and encourages proactive steps to maintain strength and vitality. Lifestyle habits also contribute to prevention. Avoiding smoking, excessive alcohol, and prolonged sedentary behavior protects bone density. Adequate sleep, stress management, and maintaining a healthy weight enhance overall health and support bone integrity. Simple adjustments, such as using supportive footwear and removing tripping hazards at home, reduce fall risk, and safeguard weakened bones. Combining proper diet, exercise, lifestyle choices, and regular screening creates a comprehensive approach to bone health. Men over 50 who adopt these preventive measures can maintain strong bones, preserve independence, and continue daily activities safely and confidently. Proactive care empowers men to reduce the risk of osteoporosis-related complications. By implementing these strategies consistently, men can enjoy energy, mobility, and resilience, preventing silent bone loss from compromising long-term vitality. Preventing osteoporosis is about more than avoiding fractures. It is about protecting independence, functional strength, and quality of life. Men over 50 who take preventive steps can maintain strong bones, stay active, and thrive as they age. Osteoporosis is often silent, but early detection and preventive measures can protect men over 50 from fractures and loss of independence. By paying attention to subtle warning signs such as height loss, stooped posture, back pain, minor fractures, and weakened grip, men can take proactive steps through proper nutrition, exercise, and regular bone density screening. Do you know someone showing these warning signs? Share this video with them, and if you found it helpful, give it a like and subscribe to Men's Vitality 50 Plus for more tips on maintaining strong, healthy bones.